Good evening, dear students. Welcome to Dr. PK classes. Is my voice is audible to you? Audio, video, सब ठीक ठाक है? एक बार चार्ट में दिखा दीजिए so that I can start the class. मेरा आवाज सबको सुनाई दे रहा है क्या? Yes. चलो ठीक है, तो शुरू करते हैं. So today's class we will be discussing the previous questions on the very uh, fundamental topic of human anatomy and physiology, that is cells and tissues. So cells और tissues के बारे में जो previous issue questions है उसके बारे में हम आज के क्लास में डिस्कस करने वाला है. ठीक है. So you can scan this QR code in order to download the notes. आप डाउनलोड करने के लिए ये QR कोड को स्कैन कर सकते हो. ठीक है. So पहला क्वेश्चन है, पोटेशियम होमियोस्टैसिस इन ह्यूमन इज. पोटेशियम होमियोस्टैसिस इन ह्यूमन इज. आंसर बता दीजिए. Yeah. So the potassium homeostasis in human is, the first option is most of the potassium are in the intracellular. जैसे मैंने बता दिया, in the intracellular fluid, ICF, the most prevalent cation will be the potassium, whereas extracellular fluid, the most prevalent cation is the sodium. ठीक है. So the first option is the right one. Most of the potassium are in the intracellular one. ठीक है. Freely filtered and completely reabsorbed the proximal tubule. Proximal tubule में तो filter ही नहीं होगा. So filter कहाँ पर होता है? Glomerulus में होगा. ठीक है. Completely reabsorption तो proximal tubule में नहीं होगा. Around 70% तक potassium reabsorption इधर में होगा. बाकी सब it will be reabsorbed in the other tubules, not entirely in the proximal tubule. ठीक है. Maintains the sodium potassium ATPase activity. ये भी गलत है. ठीक है. So the right answer is sodium potassium ATPase will maintain the potassium homeostasis. So it is in the reverse way. ठीक है. So 98% of potassium in the intracellular compartment, only the 2% will be in the extracellular compartment. So it is the sodium potassium ATPase that will maintain the intracellular potassium by pumping potassium into, at the same time, sodium out of the cell. Okay. And this homeostasis is influenced by the insulin. So what is the role of insulin on the homeostasis of potassium? That will increase the potassium take into the cell. Therefore, it causes the hypokalemia. ठीक है. In the same way, beta 2 adrenergic agonist वो भी अपटेक को increase करेगा. Acidosis will cause the hyperkalemia, whereas the alkalosis can cause the hypokalemia. ठीक है. So we'll move to the second one. Which of the following method is not used for the measurement of body fluid volumes? Not used. Just you see this word, not used for the measurement of body fluid compartments. So total body water, एक्स्ट्रासेलुलर फ्लूइड, इंट्रासेलुलर फ्लूइड, उसको मेजर करने के लिए कुछ मार्कर्स रहते हैं, जिसमें जो मार्कर नहीं है वो आप बता दीजिए. So and most of the students are saying A, B. ठीक है, देखते हैं. So antipyrin for the total body water. This is right. Inulin for the extracellular fluid. A beside A. And Evans blue for the plasma volume. A beside A. Iodinated albumin blood volume. So this we won't use. Okay? We will see the explanation. So total body water, that is the TBW, which is around 42 liters होते हैं. ठीक है? So this we can measure by using the different markers. जैसे antipyrin है, butyrated oxide है, depreciated water. So these substances are freely can cross the cell membrane and that will be distributed throughout the body water. मतलब जो भी substance हम use कर रहे हैं पूरा का पूरा body water में distribute होगा, जैसे 40 liters में distribute होगा. ठीक है, इसलिए हम इसको use करते हैं. ECF extracellular fluid markers inulin mannitol. So these both inulin mannitol doesn't enter into the cell. They remain in the extracellular space only. So therefore we will use for the measurement of the extracellular fluid. Plasma value can be measured by the Evans blue, yeah, iodinated albumin, radioactively labeled albumin, because these will bind to the plasma proteins. After binding to the plasma protein, they remain within the vascular compartment. It means they remain within the blood vessels. Hence, it can be used for the measurement of the plasma volume. So, blood volume measure करने के लिए आपको कुछ markers का जरूरत नहीं है, क्योंकि we can calculate by using this formula, plasma volume by 1 minus hematocrit value या packed cell volume. ठीक है? Yeah. Eukaryotic plasma membrane is made up of all the substances except, so plasma eukaryotic plasma membrane किस substance से बना हुआ था, उसमें से एक नहीं है. So what is that? You will see. So in the eukaryotic plasma membrane, the plasma membrane will contains the carbohydrates. They contain the phospholipids. The example for phospholipid is the lecithin, and it also contains the cholesterol. So it doesn't contain the triglycerides. It doesn't contain the triglycerides. So answer is the triglycerides. Okay. So if you see the phospholipids, you can have the lecithin. It can contain the cholesterol, proteins, carbohydrates. You can see here. So this is the typical structure of the plasma membrane, where you can have the phosphobilayer In this, we have the different phospholipids like lecithin. So in between, you can also contain the cholesterol molecules. Then you will also have the carbohydrate. This carbohydrate can maybe bind to the proteins. Okay, and you have the integral proteins as well as the peripheral proteins. So this is the lipid bilayer, and these protein molecules are embedded in the lipid bilayer. So therefore, phospholipids will be there, cholesterol will be there, proteins will be there, and the carbohydrates. These carbohydrates can be attached to the lipid or it can be attached to the proteins. If they are attached to the proteins, we call as the glycoproteins. If they are attached to the lipids, we call as the glycolipids. So triglycerides, they store the fat. Okay? And the triglycerides will be traveled in the blood in the form of the lipoproteins. So triglycerides is not a component of plasma membrane. Autophagy is associated with which organelle? Yeah, it is the energy source. Okay, triglycerides, it, it is an energy source. Right. So most of the students are giving the right answer. So autophagy is associated with the organelle lysosome. It is involved or associated with the organelle lysosome. That is the reason sometimes this lysosome can also be called as the suicidal bag of the cell. Suicidal bag of the cell. लाइसो का मतलब होता है डिसॉल्विंग, सोम का मतलब है बॉडी. So these lysosomes are the membrane enclosed vesicles which is formed from the Golgi complex, from where these lysosomes are pinched off, bud off from the Golgi complex. So in the lysosomes, it contains various powerful enzymes, maybe the hydrolytic enzymes, yeah, digestive enzymes. It can contain more than 60 type of digestive and hydrolytic enzyme. So therefore, these enzymes will help in the recycle of worn out cell structures. मतलब जो भी organelles old होते हैं, senile होते हैं, so that get destroyed by the enzymes which are present in the lysosomes. So these lysosomes can engulf another organelle, digest it, and return the digested components for the cytosol for the reuse. Reuse करने के लिए it will send to the cytosol. ठीक है? So in this way, the organelles continuously get replaced. ठीक है, मतलब जो भी पुराना होगा, जो भी ओल्ड होगा, that get recycled by the enzymes present in the lysosome. So the process by which the entire worn out organelles are digested is called as मतलब self phase बोलते ना, phagocytosis मतलब eating, phase मतलब eating. ठीक है? So that is by a process is called as the autophagy. So we'll move to the next question. Not a cell adhesion molecule is. We have discussed these in the cell junctions. So there are various cell junctions. The cell junctions are mainly made up of the proteins. So which of the following is not a cell adhesion protein? हाँ, ये जिपमर का क्वेश्चन है भाई, प्रीवियस ईयर जिपमर का क्वेश्चन है। सो जो भी हम डिस्कस कर रहे हैं वो प्रीवियस ईयर का मेडिकल डिफरेंट एग्जाम्स, कॉम्पिटिटिव एग्जाम्स। सो इंटीग्रिन, cadherin, selectin, they are the examples for the adhesion molecules. So spectrin is a not an example of the adhesion molecule. Okay? So we will see. So the cells are attached, the cells are attached each other by the adhesion molecules. Okay? Like integrins, adhesion molecules, cadherins, and the selectins. So that we will also covered in the cell junctions, like in the adherent junctions, the the protein is the cadherins, whereas desmosomes also contain the cadherins. Then hemidesmosomes, in place of the cadherins, it contains the integrins. Okay. In the gap junctions, there is another type of protein called as the connexins. Okay. So therefore, the spectrin is not a adhesion molecule. Okay. Which of the following statement about the facilitated diffusion is true? So कौन सी सही है facilitated diffusion के बारे में? It is a form of active transport. ये active transport नहीं है, वो passive transport है, इसका energy जरूरत नहीं है. It requires a carrier protein. Yes. क्वेश्चन में आपको आंसर है facilitated diffusion. मतलब वो जो भी डिफ्यूजन है अपने आप नहीं होगा, उसको लेने के लिए, उसको फैसिलिटेट करने के लिए एक कैरियर का जरूरत होता है, एक कैरियर प्रोटीन का जरूरत होता है. ठीक है, मतलब ये सही है. रेट ऑफ ट्रांसपोर्ट इज प्रोपोर्शनल टू द कॉन्सेंट्रेशन ग्रेडियंट. दिस इज नॉट कंप्लीटली ट्रू, तो हम अगले स्लाइड में डिस्कस करेंगे. requires energy, doesn't require energy because it is a passive process, not the active process. ठीक है, तो देखते हैं हम. So facilitated, so the diffusion, the meaning of diffusion is there is a transfer of drug or transfer of solutes from the higher concentration to the lower concentration. ठीक है, higher concentration to lower concentration, उसी को हम बोलते हैं diffusion. So generally most of the times it occurs by the simple diffusion from higher to low. The molecules or the solutes or the drugs which are highly lipid soluble, so they can easily cross the membranes. They can easily cross the membranes. That means they move from the higher concentration to lower concentration. मतलब extracellular fluid से intracellular या cytosol तक पहुंच जाएगा, because वो ज्यादा lipid soluble है. Assume that if the molecule is not lipid soluble, if it is polar substance, then वो कैसे इसको क्रॉस करेगा? क्योंकि जो भी मेम्ब्रेन है that is highly लिपिड बाइलेयर है, सो जो भी लिपिड सॉल्युबल होता है वही क्रॉस करेगा. ठीक है, सो जो भी वाटर विच एवर आर पोलर मॉलिक्यूल्स, सो दैट कैन नॉट ट्रांसफर इनटू द सेल. इट रिक्वायर्स a carrier molecule. It requires a carrier molecule, or there may be some channels. Through channels it can enter within the cell. ठीक है, so it can be the channel mediated and this the carrier mediated facilitated diffusion. ठीक है, and if you see the rate of transport is initially proportional to the concentration. मतलब जैसे जैसे हम concentration को increase करेंगे ना वैसे rate of absorption भी increase होगा शुरुआत में. But when the carriers get saturated, जितने भी carriers है वो पूरे saturate हो गए, ठीक है, तब उसकी क्या होगा, जितना भी तू concentration को increase करेगा ना तब उतना absorption नहीं बढ़ेगा. Because whatever the molecules, whatever the carriers that have been get saturated, become saturated at higher concentration. So therefore the rate of drug absorption will be constant, will be constant. So that is the main important distinguishing feature between the passive diffusion as well as the carrier mediated diffusion. वॉइस कम आ रहा है भाई, चांस ही नहीं है. Active transport across the cell membrane is mediated by, same question है, repeated है, which is very much similar to the previous question. क्लियर है ना? ठीक है, ठीक है. So active transport across the cell membrane is mediated by the carrier protein. ठीक है. So active transport across the cell membrane, generally that active transport is of two types. One is primary active transport. Very important example is the sodium potassium ATPase. ठीक है. And the other one is the secondary active transport. So whatever the mechanism, both of them are mediated by the carrier protein. And because it is the active transport, which means it requires energy in the form of ATP. Why it requires energy? Because now the molecules are, or whatever the drugs or solutes, whatever that are moving from the lower concentration to the higher concentration. ठीक है, वो लो से हाई मूव हो रहा है, इसलिए उसके लिए इसका एनर्जी का जरूरत पड़ेगा. ठीक है. इसको हम अपहिल बोलते हैं, अपहिल ट्रांसपोर्ट. मतलब हिल को चढ़ना है, पहाड़ को चढ़ना है. सो पहाड़ को चढ़ने के लिए हमको ताकत चाहिए, एनर्जी चाहिए. रेस्टिंग मेम्ब्रेन पोटेंशियल, रेस्टिंग मेम्ब्रेन पोटेंशियल या उसको हम आरएमपी बोलते हैं, इज मेनली ड्यू टू, जनरली रेस्टिंग मेम्ब्रेन पोटेंशियल इट इज अराउंड -70 मिलीवोल्ट कहते हैं. जो -70 जो मिलीवोल्ट रहते हैं ना, दैट इज मेनली ड्यू टू -70 और -90 वॉट एवर. ज्यादा स्टूडेंट्स ऑप्शन ए मतलब सोडियम को ऑप्शन दे रहे हैं, वो गलत है. So the answer is the potassium. The answer is potassium. Okay. So the resting membrane is primarily established by the movement of the potassium ions across the cell membrane. So as I told that most of the ICF intracellular fluid may important prominent cation is the potassium. Okay, that is one factor. At rest, the membrane is highly permeable to the potassium. Why? Because there are potassium leaky channels in the plasma membrane. There are various potassium leak channels will be there. Okay, so therefore the potassium can be easily comes out of the cell. Okay, so the potassium tends to move out of the cell down its concentration gradient, leaving behind a net negative charge inside. मतलब जब भी ज्यादा पॉजिटिव चार्ज बाहर जा रहा है सो सेल के अंदर नेगेटिव चार्ज ही क्रिएट होगा ना सो विच रिजल्ट्स इन द नेगेटिव मेम्ब्रेन पोटेंशियल so mostly it will be -7 millivolt and this why it is around -7 millivolt because this is very much close to the equilibrium potential of the potassium which is around minus 90 millivolt. ठीक है. So the resting membrane potential is mainly established due to the potassium. Due to the potassium. Non-myelinated axons differ from myelinated axon in that they. So main difference between the myelinated and non-myelinated axons. Yeah. So non-myelinated axons doesn't contain the lag doesn't contain the node of Ranvier. ठीक है तो देखते हैं क्या है. So in the myelinated axon there is a myelin sheath around the axon. So in between there is a small gap left over. उसी स्मॉल मतलब जहां पर भी माइलिन शीथ नहीं होगा ना उसी एरिया को हम नोड ऑफ रैनवियर कहते हैं. ठीक है. सो नॉन माइलिनेटेड अनमाइलिन एक्सन नोड ऑफ रैनवियर का चांस ही नहीं है क्योंकि उसमें माइलिन शीथ होता ही नहीं है. ठीक है. सो देयरफॉर देयर इज नो क्वेश्चन ऑफ नोड ऑफ रैनवियर इन द केस ऑफ नॉन माइलिनेटेड एक्सन. सो इसके से क्या होगा एक्शन पोटेंशियल विल बी जंप्ड. इसी को हम कहते हैं saltatory conduction where the action potential will be spread by the saltatory conjunction or leak or jump के माध्यम से that will be spread to the next neuron. So in the non-myelinated axons doesn't contain these nodes. So therefore the conduction is the continuous होता है saltator नहीं होगा. ठीक है. Schwann cells क्या होता है? So Schwann cells are the a type of glial cells. They are the a type of glial cells. So in the ANS or in the PNS, peripheral nervous system, the Schwann cells will produce the myelin sheath. So the Schwann cells are capable of producing the myelin sheath in the PNS. Whereas in the CNS, what the myelin sheath are produced by which type of cells? So in the CNS, myelin sheath or myelin protein is produced by the oligodendrocyte cells, which is a type of glial cells that is present in the CNS. Okay. True about Nissl granule. Nissl. So true about Nissl granule, present in the dendroid, involves in the protein synthesis, and structurally they are endoplasmic reticulum. So all of the statements are correct. So all of the above is the right one. So you can see here. So these are the structures which are composed of the endoplasmic reticulum. These are the Nissl granules, and these are distributed throughout the cell body. Okay, and with the granules also very much rich in the RNA. Even And the same one more thing is the Nissl granules doesn't find in the axons. It is present only in the sometimes it also present in the dendrites, and it is mostly present in the cell body, but it is absent in the axons. Yeah. So you have a Freedom Festival offer on all the Brahmastra courses. The offer is valid only for the 4 days. Starts from today. So आज से 4 तक ये offer रहेगा on all the Brahmastra courses 2026, 2027, 2028 and 2029. Okay, in all the courses you have the offer. And one more thing is ebook access will be provided free फॉर 1 सेमिस्टर. एक सेमिस्टर का आप बिल्कुल मुफ्त में मिलेगा. ठीक है, जो भी लोग हमारा कोर्सेज को परचेज करें ना, उन लोगों का बिल्कुल ई बुक मिलेगा 1 सेमिस्टर का. एंड दिस ऑफर इज अप टू August 4th. ठीक है, so those who are not subscribed yet, you can do subscribe. You can do purchase our any course depending upon your semester. ठीक है. And we also have offer on unlock GPAT 5 books or unlock GPAT on the 6 books. With these books, you have a test series package that we call as the Agni Paraksha will get at free of cost. So those who purchase our books, whether it is a 5 book or 6 books, they will get the test series worth of 1000 will get free. ठीक है. Yeah. अगला क्वेश्चन. When RBCs are kept in isotonic sodium chloride solution, खत्म नहीं हुआ अभी। इसका आंसर बता दो। Yeah. So when the RBCs are kept in isotonic sodium fluorescence, what will happen? There will not be any movement of solutes across the RBC membrane. The RBC shape and size will not change because the osmotic pressure across the membrane is same. The solute will not cross across the membrane. All of this. So the answer is the RBC shape and size will not change. This is only the answer. Okay. So there will not be any movement. There will be movement. ठीक है. So जितना भी water, जितने भी solutes that are going inside the cytosol will be same as that are leaving the cytosol. ठीक है. वो equal होते हैं. But there will be movement. So all of this नहीं है. We will see. So when RBC is kept in the isotonic solution, so there will be a equal inflow and equal outflow. Okay, which means there will not be any change in the volume or shape of the RBC. उसी को हम कहते हैं आइसोटोनिक. आइसो मतलब सेम. ठीक है. But when you keep the RBC in the hypertonic solution, so what will happen? Sorry, hypotonic, not hypertonic, hypotonic solutions. So hypo matlab less solutes, which means there will be a more amount of water will be there. So then the RBC में water less होगा, बाहर में water ज़्यादा होगा. So therefore the water will move from higher to the low. So there will be a more inflow of water into the RBC. ज़्यादा water जाएगा तो क्या होगा? जो cell होगा ना, the cell will swell, and it will reach a point. There is a burst of the cell that we call as the lysis of the cell होता है. Because in the RBC, it can cause the hemolysis. So after swelling, it can break, it can burst. तो उसको हम कहते हैं hemolysis. ठीक है. When you keep the cell in the hypertonic solution, so hyper मतलब ज्यादा सोल्यूट है. इसका मतलब है वाटर विल बी लो एंड आरबीसी में वाटर ज्यादा होता है, इसलिए आरबीसी साइटोसॉल से पानी बाहर आएगा, वाटर बाहर आएगा. ठीक है. सो व्हेन द वाटर कम्स आउट, द सेल गेट श्रिंक, क्योंकि बाहर पूरा निकल के आ रहे हैं ना. सो देयरफॉर द सेल गेट श्रिंकेज और श्रंकेन. इसको हम कहते हैं क्रेनुलेशन या क्रेनेशन इफेक्ट बोलते हैं इसको, क्रेनेशन. And this crenation will be reversible. Reversible means, so when you keep this RBC in the isotonic solution, then it will comes to the normal shape and a normal volume. Therefore, it is a reversible crenation या crenulation. ठीक है. Yes. Next तो वही क्वेश्चन है. The crenulation effect on the cell wall is caused by dash solutions, and this effect is. So as I told you, So as I told you, it is caused by the hypertonic and which is reversible, which is reversible. Just now I have shown here. Yeah. When we keep on the hypertonic solutions, there will be a shrinkage of the RBC. That effect is called as a crenation or crenulation, which is reversible. Okay. So example of hypertonic solution is the 2% sodium chloride solution. The size of aqueous filled pore is how many angstroms? Yeah. So it is around 4 to 10 angstroms. So the osmosis occurs, the process of osmosis will generally occurs through the aquaporins. Aqua matlab water. Pore matlab very tiny hole. So that can enter through the aquaporins. And these aquaporins are present in the membrane, plasma membrane. And the size of the aqua filled pore is the 4 to 10 angstroms. Which of the following type of epithelium is present in the bronchioles and fallopian tubes? कौन सी टिश्यू होता है उसमें? All of them are saying the cuboidal, but वो गलत है. So the answer is the columnar epithelium. So uh, the simple columnar epithelium will have different adaptations to perform the different functions. जैसे एक adaptation है microvilli. So these microvilli will be present in the small intestine where it can greatly enhances the surface area. So जैसे surface area increase होगा ना, इसके वजह से absorption भी ज़्यादा increase होगा. एक adaptation है, दूसरा adaptation है cilia. So ये cilia कहाँ कहाँ पे रहेगा? Uterine tubes, fallopian tubes, where the ova are propelled along the ciliary action towards the uterus. That is one. The second location is the inhaled particles that stick to the mucus layer are moved towards the throat by the cilia, which is present in the respiratory tract. So these are the two important locations where you have the columnar ciliated epithelium. ठीक है. The type of epithelium found on the dry surfaces which are subjected to wear and tear. तो ड्राई सर्फेसेस में कौन सा टिश्यू होता है? या सभी लोग इसका आंसर तो सही बता रहे हैं. So in the dry surfaces which are subject to wear and tear contains the keratinized stratified squamous epithelial cells, epithelial tissue. So stratified, it have keratinized, non-keratinized. So this is mainly based on the presence or absence of the protein that we call as the keratin. Okay. So whichever the tissue will contain the keratin, that we call as the keratinized. Whichever that doesn't contain keratin, we call as non-keratinized stratified epithelium. So this keratin epithelium will present on the dry surfaces, which are mainly subject to the wear and tear, like skin, hair, and the nails, which are mostly subject to wear and tear mechanism. And the surface of these tissues will contain the dead epithelial cells that have lost their nuclei, but they contain an important protein, the keratin. Due to the presence of keratin, the surface of the tissue will have the very tough and relatively waterproof protective layer. So that will prevent the drying of the underlying cells. That will prevent the drying of, मतलब जो भी उसका नीचे रहेगा ना उसका ड्राइंग होने से रोक लेगा. ठीक है. Then non keratinized stratified epithelium, which presents or which protects the moist surfaces that are also subjected to the wear and tear, like the conjunctiva of the eyes, the lining of the mouth, pharynx, and the esophagus, and which also present in the vagina. So in all this, you have the moist surfaces. Okay. Okay. So we will be covering all the questions from the different competitive exams, different competitive medical exams. Okay? So these are our different batches: 2026, 2027, 2028, and 2029, and this is the even droppers batch. So depending upon as per your convenience, you can join any our courses. Even these are the very our reference standard books for the preparation of any competitive exam, not the GPAT or NIPER. You take any competitive exam, pharmacist, drug inspector, drug analyst, you take any exam. So these are the, we can say, very standard or reference books for all the competitive exam. You have 5 volumes, and for NIPER you have one more extra non-pharma. There we have the 6 books. Thank you all. किसका कुछ पूछना है तो पूछ लीजिए. Any doubts? Thank you all. Good night. All clear? Good, good, good. Thank you, sir. God of pharmacology. अरे यार, thank you. हाँ, कल क्लासेस होगा ना, हमारा रेगुलर क्लासेस है।